Hi, everybody. Welcome. Just taking a minute to let everybody get in. We're really glad y'all are here. Welcome to the Center for Transforming Lives Lunch and Learn. Again, we're glad you're here. For those who may not know the Center for Transforming Lives, we work with mothers and their children to disrupt the cycle of poverty in Tarrant County. We do that through a two-generation trauma-informed approach that focuses on housing supports, early childhood education, economic mobility services, and clinical counseling. Just a quick housekeeping item or two. We are recording. We will make this recording available to you when the webinar is done. We will have some opportunity for questions and answers throughout. So if you have a question, if you look at the bottom of your screen, there's a little Q&A button and you can just send us a question. So we have three really incredible panelists here to visit with us today, talking about the childcare crisis in Texas, specifically the high cost of high quality childcare. It's expensive for parents and it's expensive to provide, but there are some really great evidence-based solutions. So now I'm going to let the panelists introduce themselves, and Carol, we'll start with you.
Terrific. I am so grateful to be here to talk with such a great group of people about this really important issue. Carol Klocek, I'm Chief Executive Officer for Center for Transforming Lives, and I will share that what draws me to this work is that I started taking care of babies when I was 12 years old, growing up in a family with, there were 8 of us. So, and most of my brothers and sisters are younger. I also had a graduate focus in early childhood, and then the vast majority of my early career was spent in the child welfare field, where I worked with children in psychiatric settings, kids that had experienced significant amounts of trauma, certainly had also experienced poverty, and I was really able to see in those children the impact of trauma and poverty on their developmental abilities, their social skills, just on their physical selves. So I was just all getting to do the work at Center for Transforming Lives with this two-generation approach that is trauma-informed, that centers so much of what we do in early childhood, just brings it all together for me, and makes me so passionate about intervening early and in a really robust way. So.
Thank you. Thank you. Dr. Osborne, would you like to go next, please?
Sure, I'm happy to, and so glad to be a part of this conversation this afternoon. Thank you for inviting me. I'm Cynthia Osborne. I'm a professor of early childhood education and policy at Vanderbilt University, which is in Nashville, Tennessee. Before that, though, I was a professor at the University of Texas at Austin for 17 years. So I still feel at home in Texas, even though my home is now in Tennessee. And I also have the privilege of directing the Prenatal to 3 Policy Impact Center. And our whole goal is really to work with states to help them to implement policies that allow all children to thrive from the start. And really what motivated me to get into this work, after college and working another job for a while, I became a teacher, and I taught lots of elementary grades, but really focused on 6th grade, and was struck more by what was happening to my children and my students' lives outside of the classroom than what I could really do with them inside of the classroom. And that led me to pursue wanting to better understand how families and communities and policies work to influence our children. And I just started to move up in earlier and earlier ages with kids. And so now I begin prenatally looking at the solutions that will help them to really create the conditions in which they thrive.
Love that. Thank you. Sandra, do you like to go next?
Sure. Hi, everyone. I'm Sandra Pena. I am here at the Center for Transforming Lives as the Director of Child and Family Services. My background also started in child welfare, and I did that for a few years. And then I was introduced to this lovely program called Head Start. Most of my work was in Kansas City, and we relocated to the Dallas-Fort Worth area, in which I was the Head Start director and now the Director for Child and Family Services. A lot of the work we focus on is really trying to help very needy families often that have experienced a variety of trauma, and really trying to work with a two-generation approach where we're helping both the children and the parents, and most times the entire family with services and really helping them be school ready. And that really takes really tackling a lot of those things that are causing the trauma, whether that's mental health, whether that's homelessness, whether that's substance abuse. And so we have support staff that are offering a variety of services to connect families with those services in the communities, really trying to get to those that are the most needy and the most vulnerable in our community. And so that's really the work we focus on here in our department and at CTL. And so that's kind of a little bit about my background and the work that we're doing here.
Thank you. Let's just get into it. You know, Carol, you've been here at Center for Transforming Lives for 15 years, but really you've worked in early childhood development throughout your whole career. What is so critical about the first 3 years of a child's life, and how does their development in this stage impact the rest of their lives? And also, when we think about the future, support the workforce of that future.
Yeah. I I love this subject, and I just, the longer that I have spent in my career, the more important I realize those first 3 years and that prenatal period are for children, and how much it impacts our entire community. We know that more than 1 million neural connections are formed every second during that period. So depending upon a child's nutrition, her environment, her interaction with the adults around her, whether or not her needs are met during that time, all affects the trajectory of her life. It's such an exciting time in neuroscience because there's just so much more that we can see about the way that the brain develops and what those impacts are. You could see it so visually in scans that are being done. So it's really clear how much of an impact those early years make. Insufficient physical or verbal interaction, or the kind of trauma, the traumatic experiences that Sandra and I were mentioning in those early years. And, so we have children certainly within CTL who've witnessed violence, lots who've been evicted. That kind of instability, constant sense of danger has a permanent impact on the architecture of the brain. So research also shows so clearly that while the effects can be mitigated later on, it takes enormous effort, and then certain changes just are permanent. So really the better we do, the earlier we do that, the better it is for the child, for the family, for our community as a whole. And we really want to avoid the kind of physical impact that early trauma and deprivation can bring. So we think a lot about the kids that who have experienced any form of neglect, who don't have the healthy stimulation that's necessary for the neural pathway development. They just have a harder time succeeding in school. They have a harder time, or they've worsened health outcomes, greater behavioral challenges, less engagement in the world as adults. And of course that manifests in in how prepared or not they are for the workforce. I also happen to sit on the board for Chamber of Commerce here in Fort Worth. And I can tell you that in every meeting of that board, we're talking about the workforce. And so in the workforce, we need to be talking about, in those conversations about the workforce, rather, that we need to be talking about childcare. We need to be talking about the way that children are not being prepared because of these early experiences. So I just think that this is the most important conversation that we can be having right now.
Agreed. So Cynthia, thinking about what Carol's just said, you work with states to implement these, effective, equitable policies that ensure all children can thrive from the start and really for the rest of their lives. How do you feel Texas is doing, and what challenges do families and businesses face when it comes to this?
So Texas has a lot of opportunity to do more to support its families. When we look across the country at the policies and programs that will help children and their parents really thrive, it requires this combination of broad-based economic and family supports, as well as targeted interventions. And those include things like access to health insurance, access to paid family and medical leave, tax credits, the minimum wage or living wage, as well as things like childcare subsidies and other more targeted services. And with childcare, really bringing it back to childcare specifically, we think of this as an opportunity to support the workforce today and the workforce of tomorrow, especially when it's high quality childcare. And Texas has made a lot of gains over the last several years, and that needs to be recognized. That with the pandemic came an infusion of federal funds into childcare that allowed states to support the wages of childcare educators. It allowed them to increase their reimbursement rates, reduce family co-payments, and so forth, and support childcare providers in myriad ways. And the real key now is to think about how we can sustain some of those, because right now, childcare, I teach public policy and I use childcare as an example of what we call a market failure in economics. A market failure means that the public needs more than the market can actually produce at a price that consumers can pay. And if you think of the three different actors in childcare, you have those who are offering it, who own or operate the center. You have the educators or teachers who are providing their services to care for and create these nurturing environments that stimulate brain development in young children. And then you have the families and the children, right? The families who can pay to attend or not. And with childcare, there's not one of those three actors that are able to actually be sustaining. The parents cannot pay another dime. They're already paying, a large percentage of their income for childcare. Providers can barely keep their doors open. They don't have hardly any margin for any sort of loss or change. There's been some policies that have helped to support them, funding them based on enrollment and so forth, but they are really, really struggling. And our teachers in Texas, the average childcare teacher makes $12 an hour. And you compare that to a starting pre-K, public pre-K teacher or K-12 teacher who is making over $26 an hour. And although the starting wage, or the average wage rather, of a teacher is only $12, what I find even more astonishing is that there's no pathway for these educators. Someone who's been in the field for work in the business for 25 years makes on average $2 more than the starting teacher at $12 an hour. Someone with a BA makes just $14 an hour. And only a third of these teachers have any access to benefits of any kind. And so you see that these three different actors are all struggling to provide this essential service for families to allow them to work and allow children to really develop, as Carol was talking about, these important skills and neural connections and whole body development in these earliest years. And so Texas has an opportunity to invest more and to allow more families access to high quality, affordable childcare.
Thank you. Sandra, you and your team, you're really on the front lines with this, right? I mean, I think especially post-pandemic, it's already a population with struggles, and then post-pandemic, it's my understanding that that's gotten even worse. Can you speak a little bit about that, about some of the challenges?
Sure. Yeah, we've seen uh increase in behaviors right now with our children. Our families are experiencing more homelessness, substance abuse. We're seeing significant behavioral issues, disabilities in children, a lot of lack of social emotional kind of bonds and connections that they're having, whether it's with their parents, the caregivers that they're working with every day. It's kind of had a ripple effect then, it causes a significant stress on the teachers, on the center directors, on support staff who are there trying to help support classrooms. We have classroom of 15 to 20 children and preschoolers. We are seeing most of these behaviors in the preschoolers, ages 3 to 5 years old. And we're like Cynthia was saying, with Texas licensing, you can have up to 20 children or even more. Well, we're limiting those classrooms to 14 and 15 because we're seeing so many behaviors in the classroom that are very difficult to manage, that are difficult to being implementing high quality education and curriculum in those classrooms, because so much of the teacher's time is focused on redirection and trying to provide some one-on-one. Oftentimes we're putting a third teacher in there, sometimes even support staff like a mentor coach, sometimes the director or the assistant director. And so we're working on a variety of strategies to help in those classrooms, but they still become unmanageable. We've provided a variety of additional trainings to our staff, including conscious discipline. We're working closely right here with the Momentous Institute out of Dallas. And we're really focusing on a lot of self-care strategies. How can we help teachers really work on what self-care looks like? How, if you're not taking care of yourself, you can't take care of children. And to really being able to see what are those triggers for staff and children to help try to create a very nurturing environment where children are going to thrive. We've contracted with a consultant from Thriving Together, who's provided some training both for the teachers, for all staff, not just teachers, and then also for the children in those classrooms. And so it's a combination of those efforts to really try to tackle some of these things. When we're trying to use our 2-generation approach, we're often getting families that are coming in from a shelter, whether that's by our housing department or some of the other shelters that we partner with. They're in desperate need of childcare, right? And so they're bringing children who may have never had childcare before, been in a childcare setting before. So this is a very new environment for them. So there's one of the factors, right, that plays a role. And then again, building relationships and trusting adults, and being that consistent adult in the classroom is kind of where we are. We're trying to build those relationships with children, and ultimately so that they can be school ready. Like Carol was saying, they're going to be ready for school and then ready for the workforce one day. And so we have a lot of work to do. And it does create, this kind of like chicken and egg, how do we get there? That stress is stress on the teachers, stress on the children, the parents, and so on. And so, it's a very difficult time post pandemic, but it is where we're focusing our time and attention to really help children build those social emotional connections.
A lot of opportunity there. We're going to just pause for 1 second and see if anyone has a question. If you do, you can just pop it in the Q&A. We'll be happy to take it. And if not, no worries. I have a lot of other questions, so I'll ask them for you. All right. Carol, we're going to go back to you. I think Sandra touched on some of the practices, the supports that Center for Transforming Lives is putting in. I mean, can you speak a little bit more about that as a provider, some of the solutions that we've implemented to recruit and retain, high quality caregivers, and what are the gaps that still exist, and just a little bit more about caring for the caregivers. And then I see we had a couple questions come in, so we'll get back to those in just a few minutes.
Great. I would like to emphasize that we have been providing childcare here in Tarrant County since the 1930s. So we have seen a lot of ups and downs of the business. Our focus has always been on providing the highest quality education and care available while keeping it affordable for families, even families that that Sandra talked about that are at the very lowest income level. So Sandra talked about our focus on low ratios, providing lots of ongoing and hands-on training for teachers, and providing additional supports for both the children and the parents, whether that's one-on-one support to meet a developmental need or to address health challenges. Cynthia mentioned that, that $12 an hour rate, our pay for teachers is higher. We offer sick time. We offer health insurance. And we have a great 401k. But, even as I say those, I acknowledge that that's not the reality for most providers, because you simply can't afford to do that on either the rates of pay that or the the tuition that parents pay, or the subsidies that come in, and there are not enough subsidies. I think we only have one subsidized seat for every 5 children that are eligible, or 5 families rather, that are eligible for subsidized care in Tarrant County. So it's just not enough. It's not sustainable. Our nonprofit organization can go out and seek grants, which we do, but that then isn't available to for-profit providers, and that's a much larger part of the market. So, and then we have continued to push the boundaries of what we're doing and the care that we're offering. And again, Sandra mentioned some of those, whether that's lowering ratios, teaching self-care, promoting self-care practices, giving breaks more often. Our therapists have gotten involved doing therapy with children, therapy with families, doing behavioral consults, even some group work with the older children to just really help them to understand more pro-social behavior. But it is really intensive. I mean, it's not unusual now for us to have children who come in who are 2 and 3, who are really behind in their language, who have very little in terms of their ability to verbally express what's going on, and so they act it out in the classrooms, and so it really does require a problem-solving approach, a very pro-child, pro-family approach, because when we do that, then we can kind of orient everyone around, all right, understand what's going on, and then make the modifications that we need in order to help that child or that family succeed. But it is really hard. And then just promoting and supporting the teachers at the same time. But again, all of these kinds of things that we can do, that we are doing, aren't necessarily available to most providers. But it really speaks to what is needed to help children, because it's not just the 600 kids that we serve in Tarrant County each year who need this kind of specialized intervention and care. There are many thousands of children that are not getting what they need to get them ready for school, to address what's going on with them. And I think that's part of what we're seeing when we have so many of the children in our community who are not reading on time when they are in third grade, and they are not passing their tests, or our numbers are not advancing despite all of our efforts. And in fact, we're losing ground. So I think, starting to really, by acknowledging this is our market failure, and we have to work together in a collaborative way to, really understand what the resources are and engage them, and so we can move forward. So.
Great. And then Cynthia, kind of keeping along with this line of thought, because you don't just work with Texas, you work with states, across the country. I mean, what are, when Carol talks about we need to work together, we need to collaborate, we need to fix this, what are some promising practices in other states and communities that you've worked with? And what do you think, I mean, what practices could Texas adopt to really start to solve this issue?
Well, the things that both Sandra and Carol are talking about are so important, and there are these in-class, in-facility issues that they're grappling with, which are downstream issues of families not having enough resources and having too many stressors in their lives. So there's a lot of policies that Texas and others could implement to reduce some of those stressors, like paid family medical leave, like having access to health insurance. In Texas, we have the lowest income eligibility threshold for parents in any state. In order for a parent to be eligible for Medicaid, they have to make 15% of the federal poverty line or less. And that is because we haven't expanded Medicaid. So there's a lot of upstream things that we could do that could really help some of the problems that you're seeing within a classroom. But when we think about childcare and how to stabilize the market and increase the ability for providers to be able to provide coaches, and most providers can't afford a coach. They can't even afford an additional person in the childcare facility to allow the teacher to go to the restroom. I mean, they are so pinched. But if there's different sorts of policies that states have been doing. One of the most important policies is to look for additional funding sources. The federal government may put in more money, it may not. But what lots of states have done is look for these sustainable funding sources, because if you don't put more money into the system, then you have what we call a whack-a-mole problem. If you make more families eligible, everyone gets less. If you make subsidies, more generous, then fewer folks can actually afford we can't give as many out, right? If you help teachers, you can't help parents. It's a constraint issue. So you have to bring more money to it. Our neighbor, Louisiana, for instance, has online sports betting, and they tax their online sports betting. And about 25% of those proceeds go into an early childhood fund. Colorado uses some of its tobacco tax settlement to fund early childhood. New Mexico tapped into its land grant fund. Texas is one of the few states that also has a natural resource fund that our public schools tap into, but early childhood could tap into as well, that produces additional money. So the state has the ability to make choices about now, how do we intervene from both a supply and a demand side? How do we help the families, the providers, and the teachers? And so states are spending their money in myriad ways. Some are really focused on reducing out-of-pocket expenses for families. So they are eliminating co-pays for families who are receiving subsidies. But if only, like Carol said, if not very many families actually have access to a subsidy, that doesn't help as many families as you would like. Other states are really focused on supporting the workforce. So setting wages that are closer to parity with public education, or at least setting up a kind of a ladder system where you know that there is a pathway toward higher wages as you move through. Others are supporting providers in other sorts of ways by allowing them upgrades to their facility that improve quality. And those grants then allow you to qualify for the higher, in Texas, the Texas Rising Star tiers, instead of having to go the other way. Right now, centers usually have to kind of find their way to improve quality, and then they can get reimbursed more. And if we can give grants on the front end that say, if you're willing to go this route, then we'll give you this grant to improve your quality, and then be able to pay you a higher reimbursement rate. Another way that states are trying to bring more money into the system and to get more folks involved, especially for families that are not on subsidies, but they're also really struggling to pay. I mean, there's no one who can afford to pay $20,000 a year in childcare. If we really were paying what it costs in Texas, we'd be paying at least $1,800 a month for infant care. And, there's just not very many of us who can ever afford to pay that. So what they're doing is trying to work with businesses. And, I don't know that this is a sustainable thing, but they're sharing the cost of childcare between businesses, government, sometimes local, sometimes state, and families, in order to try to reduce some of the costs there. But they're raising their reimbursement rates, they're increasing eligibility. States are doing all sorts of things, but the real thing is that more money has to come into the system. We have to prioritize it, and really think of it as a resource for our economy, for our community, in the same way that we think of public school as a resource, instead of treating it so differently. Until we do that, it's going to be hard to create a system that really provides access to the childcare that families really need.
Definitely challenging, definitely challenging.
Can I mention one thing? I'm sorry. I mentioned to you that I wanted to say, because I don't want to sound so pessimistic. So Texas has over 10% of the population of all children in the country. It's a big state, and it can do big things. Our pre-K system is actually looked at across the country as a way of, how did we get so many of our kids involved in public pre-K so quickly? And we were actually pretty creative about it. One, we have I'm still acting as if I'm from Texas, but I'm just going to continue with that. When we made it so that children who are on Medicaid were eligible, we have one of the largest populations of children on Medicaid across the country, because we have high rates of poverty in Texas. But then we got even more creative. We said, well, okay, we also have children whose second language is English. And we have a large population of students who speak Spanish or another language in their home. So that opened up the door for a lot more who are eligible. Then we did it for our military populations, our first responders. We started to think about who we could expand this to make it so that more families were eligible more quickly. And, what we have kind of opened the idea that maybe all families should be eligible for this. Maybe this is a good thing that all families should be eligible for, and we should prioritize as a state. And, we're not completely there. There's not enough space for everyone. There's issues in everything that as you try to implement. But I just want to say, when Texas sets its mind to it, it can do really important things that have a huge impact on the entire country. So, we have to watch Texas, because when it does good things, it makes a huge difference. And when it doesn't reach its potential, it's a drag on the rest of the whole nation.
Texas, always a leader, right? Always. We had a question come through. We've had a couple of folks who are childcare providers who are kind of just chiming in and saying, we're doing the work with you and thank you. And we thank all of you. One of the questions was, how do we become more of an advocate for childcare funding? What do we do? How do we, as regular people, what can we do to get out there? Any thoughts? Kind of just. Oh.
You mean, how can regular folks impact childcare funding in Texas, like make change? Is that what the question is?
Yes, I think it's a two-part of like, if someone is a provider, what do they do to
I
help?
see.
And then also, what can we do?
Yeah.
Carol, you want to answer about the provider piece?
Sure. So I think there are some really fantastic collaborative. One of the things I think we do super well in Tarrant County is collaboration. So if you're a provider and want to get more involved, I would certainly recommend getting involved with the Early Learning Alliance. So we're a member entity there, and so there's good things happening in that group. I would certainly say too, if you're interested in following up with Center for Transforming Lives, connect with Sandra. She oversees not only all of our child and family services programming, but all of our partnership efforts. And we've got a lot of partnership work that we're doing in some pretty untraditional ways. And then there are other networks, certainly, that if you're interested in more in mental health, there's Mental Health Collaborative, or the Homeless Coalition, specifically focusing on that population. So I think just finding what you're most passionate about the group and then plugging in there. I would certainly say though that this is I completely 100% agree that Texas can and has done some extraordinary things, and but needs to. I think our elected officials need to know this is a priority from us, and so talk to your elected officials. Let them know that childcare is important, and we need to be looking at a number of different ways that we can bring more revenue into the system, support Texas families. So Texas household leaders can be participating in the workforce as much as they would like to, and as much as our economy needs for them to.
I think part of that, just to part of what Carol and Cynthia were saying, is that we have a variety of partners. Money that we're receiving, we're rating our dollars, right? We're trying to use every avenue or every resource we can to help support families. One of them is that we get some dollars from the Office of Head Start. Originally, there were partnership dollars that were for us to really drive quality childcare with community childcare partners. And we still have some of those partnerships in which we are contracting with community childcares to help raise the quality of care, make sure that they have the resources they need all the way around. And that's, again, for the salaries, to have facilities that they can improve, that our children are going to be attending. And so those partnerships, that was really the intent, right? We don't benefit for one agency doing well. We need our whole community to be able to provide these opportunities for families, and we need to be in areas that our families need to access childcare. Again, being where close to their jobs, close to their schools, close to its easy access. And so that is a way that we're helping provide a variety of ways to provide childcare, not only at our centers, since we own and operate childcare centers, but then in community partnerships. We also partner with the school district, Fort Worth ISD, and that has evolved. You know, like Carol said, there's some very unique opportunities for partnerships, and not all partnerships look the same. And it's really, we're trying to create situations that are a win-win, I guess, for the partner, for us, and for the family, right? And so it doesn't benefit us to not create partnerships that help everyone. And so we go into that with an open mind on how can we help each other, because our really goal is to provide affordable childcare throughout Tarrant County and reach as many families as we can. We don't want to create barriers or make things very difficult to access services. And so this is part of how we're tackling that need here.
I'd like to just point out that Melanie Rubin is here with us today, and just made a note in the Q&A that she's the director of North Texas Early Education Alliance, and she works with that coalition to elevate a provider voice, so she can help providers who are interested connect with policy opportunities.
Thanks for sharing that. Thanks for sharing that.
We can, I'm sure, find information and put that in the chat for people to connect with Melanie.
Yep, I will add that in there in just a few minutes. Sandra, can you talk a little bit more about our 2-generation model and how that ensures that we really do meet the needs of the entire community? Do you have maybe a story that you can share with us?
Sure. We have a lot of stories, like a lot of success stories, obviously, but I think where we find families that are getting optimum success, if you will, they're coming in oftentimes from a shelter. I can think of one family in particular coming in from a shelter referred to us, then was going through substance abuse, no job, her children being removed. She says hitting kind of rock bottom, and, you know, then really making a decision to utilize the services she was getting through our housing program. One of those was obtaining childcare, right? You know, ended up getting her children back, ended up where she's been in our program a year in August now, and really kind of getting out of that system, getting her children back, being able to utilize services. But it's really families who are able to utilize the multiple programs we offer, you know, housing support, clinical counseling. There's some economic mobility opportunities for our families, if that's where they need their support. We have case managers in our family service team that are helping connect them to resources. And we understand that you can have great childcare all day, but what about the parents, right? What does that mean? What do they need? How are they going to be connected to resources? Are they able to find employment? Are they out in the workforce? And what skills might they need, or resources might they need? And so really our goal, so not only are we helping support the child that's there or multiple children, we also have a home visiting program. So it could be that maybe you're not looking for childcare, but you do want some educational resources and other opportunities for resources. And so we meet families where they are. We try to be very flexible with our programs so that it's not a one size fits all, right? And we're really trying to reach families and where is their biggest need. You know, we're doing needs assessments. You know, so often families, like we were saying earlier, continue to have needs. And if we can keep a child from birth all the way to the 5-year-old, get them into a school district, the likelihood of success then and being school ready is high, right? We don't want children dropping out of our program or disappearing and are gone and in the program very short periods of time. So we really understand that it's really, we have to tackle both the parents and the children to get successful outcomes. You're mute, Trish.
Sorry, I meant to mute myself, and speaking about the 2-generation approach, the importance of all the wraparound services, Center for Transforming Lives is moving to a new campus at the end of the year, early next year. And I wondered if you would just take a minute to talk about the importance of that as we continue our mission and our work in the community, and how that will help the community. You're muted.
Sure thing. But before I do that, let me also answer one question in the chat is about how to make sure that centers have more qualified workers who work directly with children, and so there are several different efforts going on, but one I would want to highlight is the apprenticeship program that is being run through Campfire. So we are a participating organization, and so that's a year-long program that has that combination of classroom education as well as hands-on experience learning, so that people can go into higher level positions or higher paying positions within centers. So part of preparing the workforce. But as far as our work in the community and our expansion that will happen late this year, we've renovated a property that is on 14 acres in the southeast side of Fort Worth. It will have a flagship child development center, and one that we are particularly excited about because every aspect of that is developmentally appropriate and trauma informed. So I cannot wait to be just in that playground environment and in those classrooms. Very excited about that. It will also have an economic mobility center that will allow parents the opportunity to do everything from build their resume to operate a small business, and it's got free drop-in childcare on site. So looking at both the regular ongoing full day regular program, and then plus that drop-in care in a very family-friendly environment, as well as homeless services. Our therapy services will be there, and just continuing to expand the footprint. We know that 34% of all single moms with a child under the age of 5 in Tarrant County are living in poverty, that's been a growing rate over recent years. So the more we can do and expand to meet that need in the community in a family-friendly way is better for everyone. So, but so great questions, and I'm really pleased to see all this engagement with everyone who's on the call today.
Right, and if anyone has another question, I just encourage you to go ahead and put it in now. We did have a question. I think we had some questions, and I feel like we really answered all of them. I mean, there was a question specific to subsidies, like what do we do? What do we do when the subsidy runs out and there's still more children who need help? I don't know if anyone wants to tackle that one.
I was curious that Dr. Osborne, you've looked at Tarrant County in particular in Texas. So what would you say? What's that answer when the subsidy runs out? We just don't have enough.
Yeah, well, unfortunately, the way that our child care policy works is it's a limited fund, and it's called a block grant, and the state gets a set amount of money, and once that money is spent, that money is spent. So one key is to make sure that we as a state are spending every dollar that we possibly can to maximize the amount that we can spend. So are we tapping into all of our TANF dollars? Are we tapping into all of the other dollars out there that can allow us to maximize the number of subsidies that are available? But it requires having either more money to come in or to have the subsidies be a lower rate so it can go to more people. And these trade-offs are just not simple. Different workforce regions make their own trade-offs in that. There is more consistency now than there was before in terms of what the reimbursement rate is supposed to cover, which is about 75% of your region's market rate. we could try to do a better job prioritizing who needs a subsidy, but when you have two families that both need to work, how do you choose which one needs the subsidy more? We could do more with co-pays to make it so that families have to pay more of it, so there's more to go around. There's not a good answer without more money in the system. There really just isn't one simple way to do it. And it means that we have folks who are capable of working, want to work, need to work, and that would benefit everyone if they did, who are not able to. And that's where, if we can get our business community to step in and say, this is a real drain on me being able to find folks to keep my doors open. We've seen in other states that when the business community gets involved, that it can make have a big influence on elected officials and the way that they think about things. And that's true in Texas, and many of the communities have like you were on the chamber, have a strong business voice in these arguments. But I wish I could say that there's some easy answer, but once the money runs out, there's no secret fund to tap into it. It's different than something like Medicaid or SNAP. These are open-ended entitlements, and the federal government will print money if needed in order to keep funding those, so long as folks are eligible and there's a need for it. But once something goes to a block grant, once the money's spent, it's spent, and there's no more until the next year comes around.
All
I
right.
think that's why a lot of the reason we're always looking for grants and different opportunities to have additional funding so that we can blend and braid funding, because we know one resource is not the answer, right? So it's a variety of ways. What can we tap into so that we do have dollars, trying to maximize our dollars, right? And so we're always ear to the street on where is there an additional opportunity for us for funding, because we know we're only serving a fraction of those in need of childcare services.
Well, we are closing in on an hour, if you can believe it. We have just a few more minutes. If there's anything any of you panelists would like to share, please do.
I would just like to emphasize how important it is that whoever you are and you're attending today, but particularly if you're a provider, you're a part of the community, lift your voice to help encourage our elected officials to seek more and better solutions for Texas children and Texas working families, and Texas businesses, that to really help people understand this isn't about just helping families who are low income or addressing part of the poverty problem. This is fundamental to our successful economy, and we are all so proud of the Texas economy and the opportunities that families are coming in from all over parts of the country, and they're seeking those opportunities here. But this continues to be the case that families need subsidies to some degree in order to have the childcare. Childcare is more expensive than sending your child to a state college. So as long as that's the reality, we are going to need to be creative and come up with real solutions. So get involved, raise your voice.